Kayla Stafford. I'm going to be giving an informative speech today. Diabetes is a disease that many Americans have been diagnosed with. According to the American Diabetes Association, only 7% of these people have type 1 diabetes. Interestingly enough, I am one of those 7%. In type 1 diabetes, the body does not produce insulin, which is a hormone that is needed to convert food into energy that is needed for daily life. Insulin therapy and other treatments aid in managing diabetes and living a long, healthy life. With the advancement of technology, management is made more convenient for diabetics. Today I will share information of the new management options available for type 1 diabetes. Some of these options include a glucose monitor, an insulin pen, an insulin pump. Technology has greatly advanced in management of diabetes. The simplest technological advance that has been put on the market over the last 20 years is the glucose monitor. A glucose monitor reads blood sugar levels by applying a blood sample to a strip that is inserted in the monitor. The monitor reads the blood glucose within 5 seconds of applying the sample. Tests are conducted usually before meals and at bedtime to see if the blood sugar is following a normal pattern. If the blood sugar is too high, insulin administration is needed. Insulin administration times can also be altered as a result from blood glucose testing. Glucose monitors also help determine if the patient has proper balance between insulin, diet, and exercise. An example of a glucose monitor would be this. You insert the strip at the end and apply the blood to the strip, and it pops up a reading on the screen. Scientists have recently produced an update of the syringe and vial called the insulin pen. An insulin pen is used to inject insulin. It is composed of an insulin cartridge and a dial to measure the dose, and is used with disposable pen needles. There are two pen systems called durable and pre-filled. A durable pen uses a replaceable insulin cartridge. When the cartridge becomes empty, it is disposed and a new one is inserted. An example of this would be this. And you just pop it out when it becomes empty and put a new cartridge in. A pre-filled pen is entirely disposable and comes with insulin. When the pen is empty, the entire unit is discarded. The insulin pen is favored among newly diagnosed diabetics because it is more convenient and easier to carry around than a vial and a syringe. Diabetes educator Ronnie Dean states, "My patients prefer using the insulin pen rather than the syringe because it's more convenient for them to carry around. It is also more discreet than using a syringe, so no embarrassing or uncomfortable moments. It is also more accurate in dosage and is reported to have less pain at the injection site." An example of the disposable pen would be this. You throw the whole unit away once the insulin has been used. And an example of the needle, you put it on top and just screw it on. And there it is. And then you can take it back off and use it until the cartridge is totally empty. Another advancement made in diabetes is the production of the insulin pump. The pump administers insulin, an alternative to multiple daily injections. The insulin pump allows for intensive therapy with blood sugar monitoring and carbohydrate counting. Some advantages of pumping insulin are the use of rapid insulin continuously instead of a long-acting insulin injected once per day. Convenience and discretion, deliverance of precise amounts of insulin tightening the control of diabetes, and reduction of long-term complications. Recent developments include insulin on board, bolus calculators, custom alarms, and tubeless pods. While there are many types of pumps, according to diabetes and pump educator Ronnie Dean, the Omnipod insulin pump is a favorite among newly diagnosed diabetics because it has no tubes. An example of this would be this pod. You fill it with insulin and peel the back off and stick it on the skin. And the personal diabetes manager, you hit a button and it inserts the catheter that administers the insulin. Patients wearing the Omnipod do not have to worry about their infusion sets being ripped off because it doesn't have any tubes. Pump users may need to plan where to place their infusion set if they are playing sports or participating in activities that may damage the pump. And if the batteries die, if the cannula is not inserted properly, or if the pump runs out of insulin, the user may experience high blood sugar, which needs insulin administration. Therefore, users with the insulin pump should be of age and cautious of these possibilities. There are other insulin delivery machines being tested as the need for more advances in insulin and delivery devices increase. Treatment of diabetes, like most areas of medicine, has changed considerably over the years as a result of technological advances. Although no advancement can eliminate diabetes, scientists are striving to ease the pain of living with the disease. Diabetes is a widespread and more equipment is needed daily to live. I hope my speech has provided you with information about diabetes that you were not previously aware of. Thank you for listening.